What's your take on mental health for guys on TRT? Does it really work against depression?
Yeah, so testosterone has been known to have neuroprotective and neurotransmitter effects. Oftentimes, guys that have low T symptoms will report to a clinic and then be prescribed an antidepressant, anti-anxiety, benzodiazepine, SSRI. Terrible approach, absolutely terrible. We noticed that a lot of guys that begin TRT report feeling better. Their mood improves. Again, the lifestyle changes they make further exacerbate their mood improvement. They usually come off the antidepressants. And usually, we find that guys who have some level of anxiety directly correlated to low T tend to subside. So I've seen guys who intermittently use Xanax as needed, stop using the Xanax. I've seen guys using Adderall for ADHD report less Adderall use. I've seen guys on Wellbutrin and benzos and other Zoloft all of a sudden say, hey, I'd like to wean off. I'm going to reach out to my doc and see if he can kind of wean me off. I think I'm doing well. So that's been reported anecdotally as a result of proper TRT. The one thing I will caution, there are guys who suffer chronic anxiety. It is underlying for reasons outside of hormone deficiency. It could be lifestyle, it could be genetic, it could be PTSD, a lot of trauma, it could be from childhood, it could be from other things. Oftentimes those guys will start TRT and they'll notice their anxiety increase initially. And they'll blame the testosterone for it, but here's the problem. The problem is that they thought testosterone was going to resolve every problem in their life. It's just not how it works. So when they start testosterone and the anxiety is still there, they almost lose a sense of hope. And if you think about anxiety and what it means, anxiety is nothing more than worrying about your future. Depression is living in the past, and anxiety is living in the future. And the biggest part of anxiety is hope, having the hope to a bright future, having the hope to a pleasant and enjoyable future. And when that idea becomes grim and you start to lose that hope, that's where anxiety kicks up. So when guys see TRT and they have anxiety, those guys tend to research for 6 to 12 months before they get on treatment because they're so anxious about everything. They got to know every stone's been turned. When they finally make the decision and they read all these reports about guys feeling great and they get on TRT and their anxiety is not alleviated because it's completely unrelated, their mind is blown and now they've completely lost hope because this was their last saving grace. And that's when the anxiety really comes off the deep end. So I would caution guys with severe anxiety that's due to underlying issues unrelated to hormones. Don't think TRT is going to fix it. It may make it worse. It doesn't make it worse on a physiological level, but on a psychological level, you're setting yourself up for false expectations, and you're going to blame your treatment for the increased anxiety while it's all up here. So be cautious. I've seen it hundreds of times. It's sad to see, but they really fall apart.
Leave a like and comment under this video and check out my new ebook Acne on TRT.